Welcome back to Talk of the Town. If you're like me, you may never have heard of Integration Bodywork. This is a company we're going to learn about. They're doing some wonderful things in terms of, I would say, holistic health. We're going to learn a little bit more what Scott has to say. Scott Robinson is here, and he's the owner as well as a licensed massage therapist. Again, we're talking about Integration Bodywork. Scott, thanks for being here.
Thanks for having me.
So I really am truly excited to learn more about Integration Bodywork. Give us kind of the overview.
Sure. So we're a small massage therapy practice. We're in the Corey Arts building just on the near west side. And really simply, we help people move better so they can feel better.
Simply put, well said. Let's talk a little bit more about specific services that you offer.
Sure. So Megan Sullivan, who's my other therapist, and I, we both have a lot of training in lots of different modalities. But we think it's really confusing for folks to have them all listed and have you try to pick the thing you think is going to be most effective. Really simply, we just offer 60, 90-minute sessions. We talk with you about what your issues are, what your goals are, how you respond to treatment. Do you really like and respond well to really heavy-duty pressure? Do you need a more and prefer a more gentle approach? We find the thing that's most successful to you, and we just do that.
So you're helping folks with a variety of potentially body issues, sometimes even pain.
Yep.
So it's more maybe specialized than just, a massage for relaxation.
Absolutely.
Who would you say you serve? Who are your clients?
Sure. We see a lot of athletes of various kinds. Probably 2/3 of our clients are athletes. We both have a lot of experience with CrossFitters and that sort of environment. Megan was working out of a CrossFit gym in Milwaukee for about the last 3 years before she joined us this spring. I have had my CrossFit Level 1 certificate for the last 6 years, so that's an area of expertise for us. But we sponsor Leah Schneeberger, who's a professional mountain bike racer here in Madison. She won the Fat Tire Berkey this spring, so we see a lot of cyclists, a lot of Nordic skiers, lots of active people who understand they need to take care of themselves. We also see a lot of professionals, small business owners who are really committed to their own health and wellness.
Wow. Okay. So that's a lot of different folks, but you mentioned some specialties in there. I imagine that anybody that has any kind of ache or pain or is dealing with a muscular body issue, you could potentially help. What are some of the more common complaints that you're seeing from folks?
For sure. Yeah. So I think low back pain is an epidemic. Is not too strong a word. Something like 80% of adults are going to experience it at some point in their life. So we see a lot of low back pain, a lot of shoulder issues, sciatic pain, plantar fasciitis. But also some less common things. We've helped folks with like lifelong issues with headaches. We can't necessarily do anything about the symptoms themselves, but if you're also having trouble getting your chin down to your chest, for example, if we help you improve your neck range of motion, often the frequency of those headaches goes down considerably. I worked with a gentleman this last fall for about 6 months who needed a hip replacement. We were able to help him take the lift out of his shoe, help him restore a normal walking pattern. He still needed hip replacement because I can't do anything about the bone that extra bone that grew in there. But I was talking with him this spring, and it sounds like he had a really successful rehab, in part because he had healthy movement patterns before he had the surgery.
Wow. So what I'm hearing, I really like the idea of, like you said, or we said earlier, sort of a holistic approach versus necessarily treating with drugs or something like that. You're able sometimes to get to the source of the problem, it sounds like.
Right, exactly. Yeah, and I think a lot of people are really frustrated with going to their primary care physicians for pain, not because they aren't excellent physicians, but because their options are sort of pain relievers, muscle relaxants, and surgery maybe. Maybe you get a PT referral, but you have to wait 7 weeks to get in to see them. Yeah. Right? You can get in to see us much sooner, and if you're already seeing a physical therapist or a chiropractor, we're a great additional therapy to support that work already. A lot of chiropractors don't do soft tissue work. It helps support, makes the adjustment easier, helps the effects last longer. If you've got a home stretching routine from your physical therapist and you're like me and you have trouble actually doing it, right? It's a great way to actually get the same benefits without the daily sort of self-flagellation of, well, I'm supposed to do this, but I haven't done it yet.
Wow.
So.
This is a big topic. I mean, I think it's really important what you're talking about. And for somebody who already understands maybe the importance of seeing a chiropractor, you've mentioned some really great additional benefits because an adjustment sometimes can get pulled by a muscular issue, right?
Absolutely.
So some really great points. I think we could talk for a lot longer, but you got the main points across. And I think for folks out there who are struggling with maybe some aches or pains, chronic headaches, all kinds of ailments, it sounds like this could be potentially a really good fit for them. Again, this is Integration Bodywork that we're talking about. owner and licensed massage therapist Scott Robison is here, and we appreciate your expertise and sharing your information with us.
Yeah, thanks for having me.
Thanks a lot. We've got more Talk of the Town coming up after the break, so please stay with us.